Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for making the time to join us. I hope everyone is staying dry out there today and otherwise healthy. Your families are okay, that you're managing as best you can. We're going to have a relatively quick update, I think, today, talk about our situation with COVID and talk a little bit also about our Recovery Service Center, which has really been at the forefront of our response to COVID and is now playing an even more critical role as we ramp up all of our recovery efforts. So that's what you have to look forward to today. Starting with the numbers and where we're at with COVID. We continue to be holding steady, thankfully. And in fact, in the last 48 hours, our numbers look remarkably good. So that is very good news. Total cases since the beginning of the pandemic, we're at 2,221 out of 82,000 plus residents tested. I think the most interesting sort of milestone statistic to share today is that we've now crossed the threshold of over 2,000 county residents recovered, which is a nice positive thing to focus on, that the vast majority of those who have been affected have recovered. Unfortunately, we have had 94 fatalities. That has held steady now for several weeks at 94, but is, of course, a reminder of how serious and deadly COVID can be. And I really do believe that those numbers could have been significantly higher had we not all rallied and come together, had not had the frontline workers and healthcare workers respond so incredibly and so powerfully. So it's tragic, but also, I think, a sign of how we stepped up, that the numbers are what they are. In terms of right now, our hospitalizations and fatalities, we remain holding steady at 2 hospitalizations for COVID-19. That's been steady now for about a week. In terms of active cases in the county, this number is also right in the same area, but we're slightly down, which is good news, at 116 active cases. I am encouraged by the fact that we've now had some schools start reopening in person, very few, and some faculty and staff coming back, and so far, as well as our colleges a few weeks ago, and so far, even with all those additional kind of things happening, we're holding steady right around 116 and hovering between 100 and 150 active cases in the county. In terms of monitoring any reemergence or any new developing clusters or patterns, that's where we look at the number of new positives compared to total tested each day. As I always say, that is the key metric that we're all focused on. In terms of where that metric is, some of the best numbers we've had since the beginning in March. In the last 48 hours, we've had 1,023 residents tested and only 3 new positive COVID cases. That puts us at a 0.29% infection rate, well below 1%, thankfully, and right on par with where we were during our Tuesday update. So we're now, I think, past a week at least of being below 1%. And as a county, we've been below 1.5% for 42 straight days now. So to see that trend of being below 1.5 for well over a month, the trend and the milestone of over 2,000 recovered, it is just a good reminder both of how far we've come and that we are holding steady and holding strong as we continue to make progress carefully and thoughtfully in reopening things and trying to get the economy going and society going as best we can given the situation. In terms of our hospital and treatment capacity, numbers here are basically the same as they have been. As I said, 2 currently in the hospital and more than adequate hospital and ICU and ventilator capacity should we need it, which hopefully we will not, of course. And how have we been able to do this? I think you probably know where I'm going with this. We've been able to do this because of each of you because of the 180,000 residents of the county and millions in the region that have taken seriously the health warnings from our public health experts, that have followed the reopening guidelines, which I know have been difficult and sometimes even confusing, but which have all proven as a sum together to absolutely work, with the counterexamples of other states and other places that are still very much in the fight with COVID in a much more serious way. So each of us at the individual level, again, until we have a vaccine, has to continue to keep this up, has to not let our guard down, even though I know it's more and more trying each day. It's just so important that we not lose that focus and that commitment to not just keeping ourselves and our families safe, but everyone around us, especially the most vulnerable from a health perspective and other risk category perspective. So that means the big three: wearing masks, maintaining that social distance, washing hands, and using hand sanitizer. As I'm out and about, I really am very proud and appreciative that I really have almost never seen folks not doing these things. And just talking to family and friends in other parts of the country, that is not the case. I can tell you, I was anecdotally talking to a fellow county executive in another state in the Midwest, and he said they've had a fight from the very beginning to help people understand the importance of masks. And so I don't think we should take for granted how impactful that's been in New York, and how that's because of each of us really emphasizing the importance of that and taking it seriously. So thank you, and let's keep it going. Transitioning to the second part of our update today. We always talk about the COVID situation, of course, but I also think it's important to put the public health aspects in a larger context of what's happening in our community and really the broader recovery, because as we know, we started with sort of a gut punch from a public health perspective, but the ripple effects of that on our economy, on really all the different pieces and fabric of our whole community has been huge and devastating for so many. So as we responded from a public health perspective, we also stood up our recovery task force to look at those longer term problems. One of the thing that I wanted to share with you today is I think a pretty cool story that I think we should all be proud of in what we built here in the county. 3 days after our first case was March 8th, a day that I'll definitely never forget. And 3 days later, on March 11th, we made the decision to stand up a COVID-19 hotline in Ulster County. We had no idea exactly what that would look like, how it would work, but we knew that lots of people had unanswered questions and there was a lack of information, and we wanted to be there and both through these updates, but also in a live telephone format, be able to answer those questions. So we did that, and it was staffed by county employees, by some of our 911 operators, and by volunteers from Ulster Corps and other volunteers from our community. And as we continued to man those phone lines and get hundreds of calls a day, we started noticing that the needs and the questions were shifting. People still had health questions, but they also had questions about food and housing and mental health issues and substance use issues, and other broader questions and needs. And so we wanted to meet that need, and so expanded what was a COVID-19 hotline into what we now refer to as our Recovery Service Center, which is really, the goal is to have a single place, a single point with a human face that any resident of our county can call and reach out and have a friendly voice and someone that can help answer their questions and direct them to the resources that they need. We have 20 plus departments in county government alone, and to try to navigate that can be very confusing, especially in a time of of crisis and urgency. So we brought that all together and we created this really cross-department team of our employees who are experts in all of these critical recovery services and are there for you and for the residents of our county to answer those questions. So for example, on Tuesday when we announced our program for child care support and child care funding, that's another thing that if you have questions about that, you just call the same number that you would have called if you had questions about COVID or about food need through Project Resilience. So the idea is to try to make it a little bit easier, a little less confusing, and a little more just human in how we respond to the needs of the community as they're ever changing day to day, week to week. So that is our Recovery Service Center. And I especially want to give a shout out to the members of our county team who are staffing and manning that. Many of them do this sort of in addition to their day jobs. Many of them volunteered early on at a time when this required taking risk and also lots of hours and time away from their families and their loved ones, and many of them are continuing to staff this. So we thank the members of the Recovery Service Center. To give you a sense in the 6 months of what that has looked like with a little bit of, I'm all about the data and the metrics, right? So that in 6 or so months that the Recovery Service Center has been operating, we've received 28,000 inbound calls, and it's remained pretty steady throughout. Obviously, in the very beginning, we had a little bit more, but those numbers have remained pretty steady. 28,000 calls and 10,000 plus service requests, meaning, coming out of that call, we specifically assigned a department or a program to meet a need, whether that was a Project Resilience food delivery or a home emergency heating need for someone that couldn't afford to keep their home heated early on when it was still cold during the pandemic, and so on and so forth. So this is a model that was born out of COVID, but that we want to continue to grow, and especially as we see the needs piling up and the pressures piling up on all of our residents, we want to make it as easy as possible to both meet their needs, but also the Recovery Service Center serves as a way for us to understand sometimes what the needs are. Because if we start to get calls about a certain thing or a certain problem, and we track all that, we can understand, oh, we didn't realize, but here's this new problem popping up, and what can we do to meet it? That's part of how we understood the child care issue, and then we're able to adjust and shift funding and shift resources and try our best to meet that need. So going forth through the rest of this crisis, and even as we build into our 2021 plan and budget, I anticipate continuing this and expanding it to the degree that we can, because I think it's really proven to be a great success and something that we want to continue. For those that do want to reach out to the Recovery Service Center, if you haven't already, I think the number was up earlier, and in terms of the hours, it is Monday through Friday, sort of normal hours, 8 to 5, but also knowing that evenings are sometimes better for folks, we're open with some evening hours on Mondays and Fridays as well. You can also always email the RSC 24/7, and they'll log that and get back to you if needed. And there's also a lot of information and a live chat function also on our website, our COVID-19 website. So whatever way you like to interact, whether it's digitally or old school on the phone, we want to be there to meet your need and be there for you. So again, to the hundreds, probably thousands of people that have called, hopefully it's been a help. If it's not, let us know, because we want to continue to make it better. And to our team that is doing this work, thank you, thank you, thank you. You are truly on the front line of helping our community get through this crisis. And sometimes, honestly, it's just someone who can be there for someone who may not have anyone else to call, and just not only provide a service, but emotionally be there to just be someone that cares, and we very much do for all of our residents. So thanks to our team on that. As we wrap up more broadly, a thanks to each of you for tuning in. I thanked our teachers and our educators on Tuesday, but I know they're now even more in the thick of getting kids back to the new normal of school. So I'll thank them again, especially this week. I know some of the districts haven't had online start yet. I think Highland, for example, starting next week, but they've had the staff back. So thank you to our teachers and educators and faculty at all of our schools for figuring this out. It's not perfect, but we're doing the best that we can to keep everyone safe and try to get back to educating our young people and taking care of our young people. And to everyone else that have been there on the front lines through this and continue to be, thank you as well. On behalf of all the residents of the county, thank you. We will have our next update for you on Tuesday. In the meantime, if anything urgent happens, we'll of course let you know. But I hope that we can continue to hold steady, to do the things that we know at this point that we need to do that work. And I hope that between now and then you stay safe and healthy and remain resilient. And we will see you after the weekend.